everyone, I'm Dr. Smrithi Nayak. I'm a consultant obstetrician and gynecologist, infertility specialist and laparoscopic surgeon at Aster RV Hospital, JP Nagar, Bangalore. Today I will be talking to you about the role of laparoscopy in infertility for successful pregnancy. With the increasing number of infertility cases, active intervention is the need of the hour. Hysteroscopy and laparoscopy are simple daycare procedures that can be done to diagnose the cause of infertility. There are multiple reasons because of which these surgeries are advised to patients. Some of them are as follows. Hysteroscopy. Hysteroscopy is a small procedure where we will be inserting a camera inside the uterus to visualize the uterine cavity. In conditions where there are adhesions, it's called Asherman syndrome. The adhesions are cut. This is a very common cause for inability to conceive. The second most common indication is bilateral tubal block. In this condition, the tubes are cannulated and tried to be opened when the tubes are blocked at the beginning of the insertion of the tube to the uterus. The third most common reason is endometrial polyps. Polyps are nothing but abnormal growths in the endometrium which impair the implantation and hinder pregnancies. The fourth reason is submucous fibroids. Now these fibroids can lead to increased bleeding during menstruation as well as prevent the implantation of a very healthy embryo into the uterine cavity. The fifth reason is if there are any abnormal uterine developmental features like a septum which needs a septal resection. Moving on to the indications for laparoscopy in patients of infertility. The first most common reason because of which we plan to operate on a patient is endometriosis. Endometriosis is a pathological condition where the uterine lining is outside the uterus in the pelvic cavity and it causes a lot of inflammation because of which the anatomy of the pelvic structures is distorted, thus leading to infertility. So in the laparoscopy surgery, we clear all these adhesions, we remove any endometriotic cysts and we keep the anatomy as it was before. The second reason for laparoscopy is fibroids. Now fibroids are situated in different parts of the uterus and accordingly, depending on the size as well as the position of the fibroid, the surgery is planned. Remember, not all fibroids lead to infertility. So be very decisive when it comes to which fibroids need to be operated on. The third reason that we commonly do laparoscopy is for a condition called PCOS, polycystic ovarian syndrome. I'm sure a lot of you have already heard of this condition. In this condition, we advise for something called ovarian drilling, where we know the volume of the ovaries are very high and we inject or we cauterize certain parts of the ovary so as to reduce the volume of the ovary and to normalize the hormonal imbalances caused due to the PCOS. The fourth most common reason for advising a laparoscopy in infertility cases is if there are ovarian cysts. Now ovarian cysts are of many types. They can be a dermoid cyst, it can be an endometriotic cyst, or just a clear cyst which is very big in size. These cysts can hinder pregnancy and after a couple of cycles of ovulation induction, we advise the patients to undergo the cyst removal. The problem with leaving these cysts just the way it is, in spite of it not really causing any problem, is they can undergo something called a torsion, because of which the patient presents to the emergency with acute pain. The fifth most common reason are if there are problems with the tube. Hydrosalpinx is a condition where the tubes are diseased and can contain certain material which again hinder pregnancy. In such cases, these tubes may need to be disconnected from the connection to the uterus so that it does not hinder pregnancy. Apart from that, again, we also are approached by patients who want the tubes to be reversed or recanalized. These are patients who have completed their family and have undergone a tubectomy. But for unfortunate reasons, if they have lost their children, they need the tubes to be reversed, because of which they can conceive again. The last indication for laparoscopy in infertility can be unexplained infertility. In this, we know that there are certain factors which we cannot always see directly. So doing a diagnostic hysterolaparoscopy gives a lot of answers for our questions as to why the couple may not have conceived. It may be because of a distorted tubo-ovarian relationship, because of adhesions inside. It can be because of certain endometriotic spots which may not have been diagnosed in a scan. Also, there can be certain adhesions inside the uterus because of which the patient may not have conceived. So these are factors which can be taken care of by doing a simple diagnostic hysterolaparoscopy. Moving on to the procedure of hysterolaparoscopy, as I already mentioned, it is a daycare procedure and most of the patients can get discharged on the same day. The pain is quite minimal as it is a keyhole surgery, and the post-op recovery time as well as the post-operative pain is minimized. In this procedure, the anesthesia given is usually general anesthesia where the patient is completely sedated, and after the anesthesia is given, the surgeon places a needle inside of the abdominal wall to inflate the abdomen with gas. After this, a camera is inserted into the abdominal cavity to scan the abdominal structures as well as the pelvic structures. After this, certain other ports are placed to help in introducing instruments which will ultimately lead to the surgery. In a hysteroscopy, on the other hand, there are no cuts or there are no incisions placed on the abdominal wall. It is a procedure done only from below where the uterine cavity is inspected and the route used is the vaginal route. Certain complications are needed to be understood before a patient opts for these procedures. During the surgery, there can be injury to certain vital structures because of previous surgeries and the bowel and bladder adhesions. There can be some amount of blood loss in cases of huge fibroids where appropriate arrangement of blood needs to be done before the surgery is planned. The other factor is infection, and this can lead to poor healing of the incision sites. The general condition of the patient is very important before a surgery is planned, and the patient has to be optimized before taking up for surgery. This is all you had to know about the role of laparoscopy in infertile patients for a successful pregnancy. You can avail all of these facilities at Aster RV Hospital, JP Nagar, Bangalore. Please leave your comments in the comment section below. Thank you for watching.